If you have an L5-S1 disc bulge and every step sends pain shooting down your leg, this video will show you 5 simple yet different exercises you can do daily to relieve that pain, restore movement, and finally start feeling like yourself again. We'll go step by step through each exercise with exact reps, sets, and timing so you know exactly what to do and how to do it, all from your home without any special equipment. I've used these exact exercises with patients for years, helping them walk farther, sit longer, and get through their day without that constant nerve pain slowing them down. And the final exercise in this routine could be the one that gives you the biggest sense of relief, especially if you've tried everything else and nothing has worked. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat you and relieve that debilitating back and neck pain without drugs, without surgery. I upload a new video every week. I chose these exercises very carefully because each one has a specific purpose in helping your spine recover. They're designed to take pressure off the discs, calm irritation around the nerves, and restore movement in a safe and gradual way. I've also put them in a specific order. We start with the gentlest, least demanding positions first, then work our way toward more active movements. This way, your back has time to adjust, the pain can settle, and you can keep making progress without setting yourself back. If you want to do the full routine, follow the sequence exactly as I show it. I'll give you the reps and sets for each exercise, but if you're in more pain or just getting started, begin with 1 or 2 exercises for a week or 2, then add the next ones or swap them in as you improve. Let's start with exercise 1. All right, exercise number 1 is what we call the prone pillow prop. What the prone pillow prop is what we call a static extension support. So you notice Tanya's doing nothing other than basically her chest is up on a pillow. So you're going to lie face down with 1 to 2 pillows underneath your chest, depending on your size. The elbows are going to be resting on the floor. You're going to hold this position for a good 2 to 3 minutes. And what it's doing is it's actually giving you what we call passive lumbar extension without any muscle strain. So there's really no muscle involvement here at all, but you're moving into extension. So remember when we're talking disc herniations, when there's pressure on that disc, if you can see this, is that disc is going to bulge out onto that nerve. And what we're doing with the prone pillow prop is by coming into that lumbar extension, we're not putting pressure in the flexion and forcing that disc out anymore. We're doing the exact opposite where we're bringing that back. But you're doing it with next to no effort on your part. That's why we call it a passive stretch. So you're going to want to do this, get in the proper position, and then you're just going to lie in this position for a good 2 to 3 minutes. If you can do that every day, that's great. If you can do it multiple times a day, but it's just one repetition of 2 to 3 minutes. Exercise number 2 is what we call the prone hip shift extension. So what's happening in the prone hip shift extension, very similar. We want to lie face down. We're going to shift the hips slightly towards the pain-free side. So in Tanya's case, pain is on the left side. She's shifting slightly towards the right side. And now what she's going to do is she's going to just slowly press her chest up, keeping the hips down. You're going to only hold this for 2 or 3 seconds or so. You're going to go back down. You're going to repeat this for 6 to 8 repetitions. Again, now the purpose of this is we're trying to centralize the disc material to get it away from the nerve root. So that's why we're going to the pain-free side. We want to get off this. And again, it's an extension move. So anyone with disc bulges, disc herniations, they are far better doing extension versus flexion. Remember, flexion is like that jelly donut. It's actually going to put pressure on the one side, which is going to cause the disc to bulge out the other side. We want to do the exact opposite. So again, you're just holding for 2 or 3 seconds. If you feel you're a little unstable, you can see now Tanya is actually hooking the leg, and that's going to give her a little more stability when she does that movement as well. That's the, what we call the prone hip shift extension. All right, number 3 is what we call the supported side lying position. So what that means is you're going to lie on your side like this. The pain-free side should be down. So the side that is actually hurting you should be on the upside. You're going to lie on that pain-free side. You're going to have a pillow between the knees, you'll notice here, and you can even have a rolled towel under the waist as well. Again, you're just going to hold this position, just 1 repetition, but you're going to hold it for a good 2 to 3 minutes. Remember to breathe properly through all of this. The purpose here is we're trying to open up the nerve space in the painful upside while really keeping the rest of the spine relaxed. So again, the supported sideline position, with the pain-free side should be down, and so the pain side is up. And again, you're just lying on the side. That's going to open up that space where there's pressure on the nerve. On the painful side, we're keeping the rest of the spine nice and relaxed. All right, number 4 is what we call the standing counter lean, otherwise known as what we call supported extension. So you're going to stand facing the counter, as you see Tanya's doing right here. You're going to place your hands on top. You're going to step back slightly, and now you're going to let those hips drop towards the counter. So again, you can see we're creating a gentle back bend, otherwise known as extension. With any disc herniation, disc bulge, you want to get into an extension position. We're going to hold for 5 seconds, and then we're going to come back up. It's really that simple, that straightforward, and then we're going to repeat. We're going to repeat this 5 to 8 times. If you can do this every day, that's great. 5 to 8 times. The purpose here is to get some gentle upright extension to reduce disc pressure. So 5 to 8 times. And number 5 is what we call the kneeling chair-assisted spinal traction. So some people call this spinal decompression. If you are a client, patient, viewer of mine, you know this is not decompression. True decompression creates negative pressure inside the disc, and that's what we do with our non-surgical robotic laser spinal decompression. What you're going to do in this one is you're going to kneel on a soft mat in front of a sturdy chair, as you see Tanya's doing. You place the forearms on the chair's seat. The hands are going to be clasped, or holding onto the chair, as Tanya was also doing. Either one's acceptable. You're going to shift your hips back towards your heels. So see the movement here? You're going to let your chest drop slightly towards the floor, and you're going to hold this for 20 to 30 seconds. Remember to breathe normally throughout all of this. You're going to repeat this 2 to 3 times. Again, in this case, the purpose is what we can do is we can also elevate the arms to lengthen the spine and gently traction the lumbar discs without any strain. So again, we're getting the body into extension. We're getting some gentle traction on the area. That's going to take some of the pressure off the disc, off the nerve. Again, hold this for 20 to 30 seconds at a time. Remember to breathe. Repeat 2 to 3 times. It's called the kneeling chair-assisted spinal traction. You now have a complete sequence of 5 gentle, effective exercises that may help to relieve pain from a lumbar disc herniation, reduce pressure on the nerves, and restore movement so you can start getting back to the things you enjoy. I'd love to know which exercise gave you the most relief. Was it the prone pillow prop or the hip shift extension? Tell me in the comments below. If you got value from this video, please like and share it so others dealing with the same problem can find the help they need. And remember to subscribe if you want expert tips, simple exercises, and proven non-surgical solutions that help you move better, feel stronger, and stay pain-free. If you want one of the safest and most effective ways to treat and fix a disc bulge, a disc herniation, or spinal stenosis without surgery, please go check out this video here on non-surgical robotic laser spinal decompression. You'll see how it uses 2 research-backed treatment methods that, when combined, have over a 90% success rate in relieving pain and helping people return to normal function even when they think they've tried everything.